Hello, I am Beth Schenk, and I'm speaking with you today about environmental stewardship in healthcare. Objectives for our lecture are listed here, and we will get through these points as we go along. I'm Executive Director of Environmental Stewardship at Providence. This is a large health system in the West with over 50 hospitals and 1,000 clinics. I'm also Assistant Research Professor at Washington State University in the College of Nursing. Some of my accomplishments are listed here. These images reflect some of what we're seeing in our global environmental crisis, from air pollution and smog to novel chemicals, raging forest fires, heat stress and stroke, and worsening conditions for vulnerable populations like children, and the overall warming of the planet. A helpful framework, I think, is planetary health. What is it? Well, put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. Human health depends on the intact functions of what are called ecosystem services. These include providing nutritious food and clean water and air, regulating disease and climate, supporting the pollination of crops and soil formation, and providing recreational, cultural, and spiritual benefits. We can't live without these functions. We are truly dependent on the state of the planet, which is currently in distress. From my perspective, three specific areas are particularly related to healthcare: climate change, biodiversity loss, and resource depletion. They are relevant to healthcare because they each lead to health issues globally and because healthcare actually makes them worse, especially U.S. healthcare. If global healthcare were a nation, it would be the fifth largest emitter of greenhouse gases. U.S. healthcare represents about a quarter of those emissions, though we are one of dozens of nations. Not only do health professionals need to know about the health impacts of climate change in general, but they need to be aware of how the healthcare sector is contributing to and impacted by greenhouse gas emissions. The healthcare industry contributes almost 8.5% of U.S. greenhouse gas emissions. Typical areas of largest impact are highlighted by the gray clouds here. Hospitals are the second most energy-intensive facilities in the country. They're ranked as the third most water-intensive public buildings. We estimate that 14.5% of our emissions come from the livestock sector, and hospitals can make a big difference by serving less meat. And hospitals generate about 29 pounds of waste per patient per day in the hospital. This is a familiar slide that many of you have seen from the CDC, and it is upsetting to see so much destruction from severe weather. The frequent storms and more intense fire season cause health problems, as do other impacts from climate change. In fact, in 2019, the World Health Organization named climate change as the single biggest threat to human health. Bill Gates has recently said climate change is more difficult to solve than a pandemic, but if we don't, the negative impacts will be much worse. This graphic points out how several key alterations related to climate change affect health. And unfortunately, it does not affect everyone evenly. Communities of color, older adults, lower income communities, children, people living with poverty or homelessness are all more vulnerable to the health risks associated with climate change. This violates our sense of justice and fairness, which is one reason we are learning more about environmental justice and why we can address those risks in the communities we serve. Because the slide I showed you earlier is not our only option. We have the opportunity to create and maintain a thriving, vibrant planet and ecosystem which allows all people to thrive. So which way do we go? This is where we are at the crux of this decision and at the crux of changes in our behaviors. And we are told that this decade is extremely important in terms of keeping the warming of the planet under control. So I'm going to tell you next about a framework that I've developed that I think is helpful and also describes this whole issue of environmental stewardship in healthcare, called the We Act Please framework. So what is environmental stewardship in healthcare? This is a brief description. It's the use of responsible practices, products, and processes that decrease pollution. And hopefully that it leads to a more sustainable practice and sustainable world, but we're a long ways from sustainable. We can still address stewardship, however. And why should healthcare care about this issue? Lots of reasons, including our professional obligation, but to start at the top of the list here, resource conservation saves money. So that's the easiest way to sell this work, I would say, and it absolutely saves money. When you use fewer resources, you spend less dollars. It also helps healthcare to become more efficient because driving the waste out of healthcare requires efficient processes, great communication, policies that support this, and a change in the culture of the employees that work in healthcare. Meet organizational commitments for our organization, which is a Catholic one. This is associated with our core value of justice. Attract and retain talented employees. This is an important issue, especially with younger employees today. So students coming out of college have identified that they want to work oftentimes for a mission-driven organization, and at least for an organization that's really addressing their ESG, environment, social, and governance responsibilities. Demonstrate leadership. Unfortunately, not enough healthcare organizations are taking this on. This is an opportunity to get out in front. I mentioned meeting professional obligations. All of us as clinicians have professional obligations to help, heal, to serve, to do no harm, etc. And by addressing the pollution that we're causing from our own practice, it helps us meet our obligations. Being a good community member, and of course, we don't want to be part of the problem, and we are part of the problem, and time is short, as mentioned. Well, where do we begin with environmental stewardship in healthcare? These are all examples of issues that we deal with this topic, and it's complex. You can see that there are many different areas. This requires expertise, it requires learning, it requires understanding the regulatory side as well as the science base for this work. So to help people grab a hold of this, I've developed this We Act framework. It's a mnemonic, and I believe that the 5 elements that I'll go through cover about 90 or even higher of a percentage of the greenhouse gases that we emit in healthcare. Waste, the W is for waste. There are multiple streams of waste in healthcare. Many of these are regulated. Many of these are expensive. We have a lot of opportunity to help in our roles in healthcare, proper segregation being the most important. We can easily contaminate recycling or contaminate biohazard waste with pharmaceutical waste. We need to be very careful about how we segregate it, and that depends on knowing what to do. That depends on having policies and processes set up, proper bins, proper signage, but this is really up to every individual. Sometimes clinicians in their busy day say, well, I can't deal with waste. Somebody else is going to have to take care of that. And that doesn't work. Nobody else goes back and cleans up after us. We have to actually put it in the right place. It's not so hard. Source reduction is enormously important and much harder to do because we're used to a steady stream of all sorts of supplies and materials coming through to us, most of which is disposable. So by going upstream and thinking again about what can we do for reuse, for permanent products, for durable goods, and that requires the input of clinicians because it's clinicians who are responsible for the outcomes based on the products. And then using less is another strategy we can always use. And there's a tremendous amount of waste in healthcare of brand new products, of unwashed linen, of items that you open in a kit and never use. So really great opportunity here to reduce the waste just from stuff that is not even used in the first place. At the bottom of these slides, I include the climate impacts, and we know about this from waste. Waste in landfills creates methane, but I think the big issue about waste is that waste is an indicator of our inefficiency and of our overuse. And when we are overusing, therefore overconsuming, that sets off an entire chain of climate impacts from raw materials to energy used in production to fuel used in transportation to use in our own hands and then disposal. That entire chain is enormously impactful. So if we only look at the garbage, that's not enough of the picture. We have to look upstream at the source. The E is for energy and water, and this is what I think people usually think about when we think about climate change and our environmental crisis, and that makes sense. As mentioned, hospital buildings are very energy intensive per square foot. They run 24/7, they're never off. We have backup generators, And it's difficult to power a building with all renewable on site because of the enormous draw that we make on our energy grid. So some of the things that we can do in healthcare is work with facility staff and our policies among leaders to shift to renewable energy sources, to decarbonize healthcare. Very important. There's a lot of movement now afoot to do this on a national level in our professional organizations. And each of us as clinicians can take this to the organizations where we practice. Energy conservation also. This is better known about climate, so I'm not going to go over that part. The A is for agriculture and food. This is a big part of climate impacts, partly because for two main reasons. One is food waste. Enormous amounts of food are wasted on the preparation side, post-consumer, and so that's something that we can work on every day to try and reduce. And whatever we do waste, we need to be composting because that helps drive down the emissions if we avoid putting it in the landfill. Also, the whole agriculture system drives climate impacts. So this is why we talk about a plant-forward diet, being careful with eating the amount that we need and not wasting and not overeating, etc. And this is something that we can impact in healthcare because we do end up consuming a lot of food and serving a lot of food. So we can support local and sustainable foods, local economies. We can offer community-supported agriculture shares and local gardens. Can really push for reusable dishware because all the plastics and, God forbid, styrofoam and other single-use items really adds up to millions of pounds across the nation. Using fewer hormones and antibiotics, more organics, etc. So these are some of the ways that clinicians can contribute to this and push our health systems and hospitals and clinics to be more aware. The C is for chemicals. On the left here is a list of the chemicals of concern that we think about in healthcare. There are things that we need to do, and that's learn about the risks of exposure because we know from different studies that physicians and nurses are both overexposed to chemicals that have been measured in our bloodstream. We can also identify opportunities to reduce the use of chemicals, and then we can educate both ourselves and others, requesting justification. Do we really have to use the chemicals? If we do, we need to take good care. Climate impacts of chemicals is something that has emerged more recently. One that you've heard of, I'm sure, is the waste anesthetic agents, so waste anesthesia gas. And some of them are very potent greenhouse gases. And so there's been a movement across the nation. It's really gained more speed to replace the use of a particular one, desflurane, with other lower greenhouse gas impact agents, sevoflurane and isoflurane. And this can not only reduce greenhouse gas emissions, but save lots of money. I have some examples of that in our health system. Another chemical that's used a lot is nitrous oxide. This too is very potent greenhouse gas, 298 actually global warming potential. And harder to fix because it is inexpensive, so sites are less motivated. It tends to leak, but that's something that we're certainly paying attention to. Refrigerants. Refrigerants are the #1 item on the project drawdown list, and we certainly use refrigerants in healthcare. So that's another area that we need to steward carefully. And then the T is for transportation. So this is a challenging area. And yet transportation has passed buildings now as the largest source of greenhouse gases in the nation since 2018. So when we're taking seriously our carbon footprint, that includes for transportation, all the business travel that happens for all the different reasons, including home health care visits, hospice visits, but also flights, hotels, rental cars, etc. And it also includes employee commuting. Employee commuting is difficult because, that's people's lives outside of work, but the truth is they wouldn't be driving all those miles every day to work if it weren't for delivering the services of healthcare. So things that we can do are really to encourage somehow driving down the greenhouse gas emissions of commuting. That can be through public transport, less driving in a single occupancy vehicle, using electric vehicles or at least hybrids, developing commuter support services, giving incentives for people who don't drive every day. Telecommuting is now really important. So this is a big piece that is hard to address, but we need to. So those then become the key domains of We Act. And this bullseye on the right is just an image of showing that if for those sites on the outside that aren't really starting much yet, that's just that image. And on the inside is when I use the example in nursing, there's a standard of practice that says the registered nurse practices in an environmentally safe and healthy manner. So we should all be practicing in an environmentally safe and healthy manner. And so as we pick up our action, we get closer to that bullseye in the middle. And that together, by decreasing these elements in waste, energy, agriculture, chemicals, and transportation, we get more toward that. Okay, so then I'm going to talk about the please part. And this is really a leadership framework, but I have found each of these elements to be very crucial in addressing environmental stewardship in healthcare. First, I mentioned to you about professional obligation. And I have nursing documents here because I come from a nursing perspective. We have 3 foundational documents, and many professions have such documents. We have a nursing social policy statement that says no matter what we're doing in our role, we are also promoting the health of the public. To me, that means we need to be promoting a healthy planet and a healthy climate. Our code of ethics says that we care for and advocate for the rights of all we address. That could be the health, that could be individuals, family, group, community, or populations. So again, we're committed to advocating for the health of all. And then the specific practice standard I mentioned to you, that we practice in an environmentally safe and healthy manner. So this is important to pay attention to our professional obligation. Leadership is also key. Formal leadership is necessary for really elevating this as an issue, helping to find resources, helping to make sure there's time, connect dots, get people together, work with our outward-facing teams like advocacy teams and community partners. And also there are influencers and thought leaders who may be in a less formal position. Sometimes these are grassroots champions. Sometimes they're role models. Sometimes they're people who have done advanced studies who can help explain some of the issues. And then advocacy is a piece of leadership, and this is always important, especially for our powerful voice in healthcare, to be working with our communities, states, regions, and federal government to advance environmental health as an issue related to healthcare. People often ask me, well, where do you start? And I usually say, well, find some like-minded people because it helps to clump together. And there are many, many like-minded people who care deeply about this issue in healthcare today. And then value and build those relationships, and then be ready to both help others and to receive help. A lot of this happens kind of on the fly. It evolves. You have opportunities that come up. I think to be ready for the opportunities to seize on them when possible is helpful. The first E is for education. So you all are getting some education right now. So whether it's formal or informal as a lifelong learning event. And this is important because the science changes. We are learning more every week. If you pay attention to the literature in this area, there are hundreds of articles that come out about climate change, of course, and there are many, many articles now coming out about healthcare itself and pollution, including climate change. So there are different ways to learn, and this is important. Another thing I'll just mention is in healthcare, we have rapid turnover of staff. So it requires a constant, ongoing education because people are always coming in the door that are new, haven't thought about this, or are bringing a different lens or perspective. So education and awareness is really important. The A is for accountability, and this is something that has certainly, it's easy for this issue to fall through the cracks because people see it as optional. I don't personally see it as optional. I see that our life depends on it, and it's imperative that we address this in healthcare. One important way that accountability happens, in my experience, is through metrics, because this work is very data-driven. We want to be able to justify what we're doing. We want to demonstrate the cost savings. We want to be able to show how our greenhouse gases are decreasing, we hope, but sometimes they may be increasing based on policy decisions. And by being able to compare to national, regional, and local benchmarks, this is how you can really drive change. So dashboards and scorecards and reporting and digesting enormous amounts of data is really important. And also identifying who specifically is accountable. So from leadership to different groups to different divisions to actually leaders of those divisions. That's important, and that's not to call out or shame. It's just to identify where do we go to work with the right people. Accountability is important because we want to be true to our purpose. Again, in healthcare is very often mission driven, very often nonprofit organizations, and we can't be hypocrites. We need to be true about what, if we say we're here for health, then this is part of being here for health. Sustainable procurement is another extension of that. I'll talk more about that. And we can weave this into other measures so that our overall quality goals and our strategic planning is integrated with environmental stewardship as a piece of it. You wouldn't think in healthcare we would need to bring up the fact that science is important. But in a day of disinformation and of manipulation of facts, this is important. In all of our clinical disciplines, we know that we are evidence-based. That's one of the strongest statements that we use. We rely on it. We rely on studies. We look to the literature again and again. So that means that we need to stay abreast of the current science related to our environmental crisis because it's such an important health issue. We also need to be able to share that source material with others so that we can teach and build credibility. I also like to say we want to contribute ourselves to the body of knowledge because those who are interested in environmental stewardship in healthcare can add to what other people know about by conducting research, by writing, by disseminating our findings. And I'm sure you're familiar with the precautionary principle that especially in a time of urgency, but really any time, we don't want to wait until we are 101% sure. We need to, when there is compelling evidence, act on the best evidence that's available. We can see a history of this, which has probably slowed down our response to climate because there's been so much disagreement and really disinformation on, though there was very solid science, that now it is really incontrovertible, and in the meantime, we've lost time. The last E is for engagement. I think this work is really about cultural transformation and social transformation, and engagement of employees, of communities, of patients, of professional colleagues is key, absolutely key. And communication is one of the best ways to achieve engagement. So we need to help people learn about what they're interested in. It helps to identify what is meaningful and gives people purpose, because sometimes this work is hard and it's on top of other work and it takes creativity and drive. We always want to be in healthcare linking the care of the environment to health. It's an important piece that is sometimes lost, especially in a political discussion, and include everyone. And again, advocacy is just very important. And we know from different studies that clinicians generally don't advocate a lot. We're missing an important piece of our voice there. All right, so this then is the please part of the framework. And together that pulls this together, that we can see those three elements of planetary health that I mentioned at the beginning that I think are particularly related to healthcare: climate change, resource depletion, and biodiversity loss, can be decreased if in healthcare we are to drive our progress toward environmentally safe and healthy practice by focusing on these 5 areas of we act, and by remembering those important elements of the please leadership framework. There are some references included here, and thank you very much for listening.